Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center. I'm going over custom holistic testing for case number 01764. This is a 13-year-old Bichon with a history of hair loss on all four paws. There was a callus on the right shin, and we've been compulsively licking the paws. And so if we take a look at the IHT analysis itself, we see that most of the numbers were green or balanced. But we see a couple of chronic areas. One was the nervous system and the lower small intestine. And then we get down to some stress points here. We see the skin, the joints, the pancreas, and the stomach. And so if we break this down, well, how does this relate to the symptoms? If we look at the nervous system and the skin, if the nervous system is weak, it can drive compulsion to the skin, and that's the compulsive licking portion of this. But we see that we have the stomach, pancreas down here in the lower small intestine, and that's related to the enteric nervous system. So that connection to the nervous system there, if we're seeing some GI changes going on, that can drive and excite the nervous system and cause more compulsive licking here. Okay? We did have some sensitivities, which is a very busy list, and as you can see, we won't go into those in detail on the video, but we definitely will get a copy to you so you can look through them. But I'm going to put it together here for you right now, is that sensitivities have three main areas. We've got food or oral routes, we've got inhalants, and then we have epidermals, which we saw all three on the sensitivity list. The difference between sensitivities and allergies is sensitivities are that if you're exposed to it on a daily basis, you can be sensitive to it. But if you're allergic to it, you can not be exposed to it on a daily basis, but be allergic to it later on. And so in this case, we didn't have allergies, but we have quite a few sensitivities. And so since we had some food sensitivities, especially to certain sweeteners and grains, is that can have an effect on the GI tract, excite the enteric nervous system, cause the nervous system to become excited, and then drive compulsive licking here. Epidermals can directly affect the skin. So, for example, insects and things like that come in contact with the skin can be irritating to it, especially on the feet. And then we did have some inhalant sensitivities as well. So we got the lungs and its connection to the skin. A lot of times we'll have sensitivities related to respiratory, but then also if it excites the central nervous system here, then we get back to that compulsive licking. So you see how all of those come together as far as the intestinal tract and the skin. There was one other area with the joints, and if we do have soreness, that can cause a 13-year-old, because of a mild arthritis or mild soreness, to lick the paws as well. So we really have a third thing here that we have to deal with. So number one is that we want to rebalance the weakness or stresses. So we're going to use a product called Drain Par, and we're going to use that at 5 drops twice a day for 5 days, 5 drops once a day for 5 days, and then 2 drops a day for the remainder of the 3 months. That's going to rebalance and condition. Number two is we're going to deal with soreness, so we're going to use an orbital called Body Sore. What Body Sore is going to do is help to naturally reduce soreness in the joints, improve mobility, improve the nervous system, and so that's going to be a more natural product over the course of the 3 months. 1 T-pill twice a day. And lastly, how do we deal with the enteric nervous system and the compulsion itself? B12, 1 injection once a month. It calms down the nervous system, calms down the enteric nervous system, helps with the immune system, and so you get a lot of benefit from the injection itself. So we really have 3 tiers of therapy here to help this 13-year-old Bichon get better.